Hi, this is Nahid. I want to show you how you can clean your teeth during the orthodontic treatment. There are different types of dental hygiene aid. This one is end-off brush for cleaning around the bracket. It should be 45-degree underneath the bracket, around the bracket, and above the bracket, around the bracket, about 10 circulation motion. It can clean all the foods and materials around the bracket. When the area are so tight, like the lower anterior teeth, we use the sulcus brush around the bracket, in between, above, and underneath. It helps to clean all the foods and materials in between. Now we can use a proximal brush. There are different sizes. The bigger size for a bigger space area underneath the bracket and around the bracket between the teeth, and wherever a space is bigger, we can use a bigger size. And also there is a finger type. It's very good for when we are not at home and we want to clean our teeth. If we can just have it in our wallet and use wherever we want. One of the other dental hygiene aid is floss pick. There are different types of floss. Swing motion for the passing the through contact point, and then with C-shaped motion besides the teeth, up and down and back and forth. Also, there are super floss, and there is a stiff end. We can throw it away and pass through underneath the bracket and wire, and then wrap around our middle finger, and with C-shaped motion use this floss back and forth and up and down and the other tooth again. There's also a floss trader we can use with regular floss, but the regular floss should go through the loop, and the floss trader goes underneath the wire, and with this floss trader you can pass the dental floss to the other side and use the regular one as super floss. Also, there are plastic pick. It's a small finger type plastic extension. It can go underneath the bracket, in between the teeth, and also around the bracket to clean the tooth surfaces around the bracket. This plastic pick, along with the floss pick and the proximal brush, are very, very useful for carrying, living in your pocket or wallet and with yourself whenever you are not at home. And there is also a wooden pick. Whenever you don't have access to the other types of dental hygiene aid, you can use this one. The flat side goes beside the gum areas, and just gently you can clean around the bracket. And this is gum stimulator. Gum stimulator mainly for massaging around the gum, around the teeth, and it can go in between the bracket, between the teeth, and massage the gum for more circulation, blood circulation, to cleaning the areas and also removing some of the debris. After using these materials, you can use water flosser. Water flosser is very good for cleaning in between the teeth and also around the bracket. There is a bottle on the top of this device. You can start from 1 to 2, check the pulse and the motion, and then start. You should bend your head over the sink, and with 90 degrees angle, the water will comes out through the bristles, and the bristles can touch the bracket, but it should be, as I mentioned earlier, 45 degrees around the bracket for cleaning, above, around, underneath, and the water comes out, and you will be surprised how different materials, food, will come out even after flossing or proximal brush. Now, after using water flosser, it's a time brushing the teeth with manual toothbrush, hand toothbrush, or electric toothbrush. We really recommend electric toothbrush because of better action, better accessibility to different areas of teeth. And just in case if you don't have access to electric, you can use manual. There are two different types of toothpaste. The one with sodium fluoride, lower percentage, and the other one with Colgate Sensitive Pro Relief, the highest percentage of sodium fluoride, and it shows it has 1.1% of sodium fluoride on it. And during the orthodontic treatment, because of the higher chance to have cavities because of the brackets, it's very important to use the higher percentage of sodium fluoride, just a thin layer on the bristles of the toothbrush, and use this one on the tooth surface. It actually helps to prevent cavities on the tooth surfaces, a thin layer. And for this one, the angle should be 45 degrees and 10 circulation motion around the brackets on the top, on the tooth surface, and underneath the bracket, each of them 10 circulation motion, and from the bottom of the bracket, from the side, and from the top. Electric toothbrush, as I told you, is much better than manual toothbrush, better accessible. On each tooth surfaces should be about 3 seconds on the back surface and front of each teeth, in between the teeth, and then on the brackets area, 45 degrees. No much pressure, just gently moving and circulation, it will be done. Just remember, start from one side and continue to the other side, and then the chewing surfaces and inside your teeth. After 30 minutes of toothbrushing, you can use mouth rinse as antimicrobial, and we recommend xylitol. There is chewing gum, a lozenge, or pastille. It helps to prevent cavities and increase your saliva and protect your teeth. Thank you.